Hi everyone, I hope you're doing well. I hope you're finding useful content. Today I want to talk about something we tend to see in practice quite often, especially in this part of the world, in Nigeria, in Africa. Oftentimes people come usually and say, I have malaria and typhoid. I went to the hospital and they told me I have malaria and typhoid. They admitted me, gave me IV fluids, gave me antibiotics and all that. Now, the challenge and the caution is what I would like us to pay attention to. Now, oftentimes when people make a diagnosis of typhoid fever, they make it from what we call constitutional symptoms of fever, headaches, and all that. And then usually they do what you call a Widal test. Okay. Now, the challenge with the Widal test is that it is an antibody test that is not very specific for typhoid fever, also has low sensitivity, meaning that its ability to pick typhoid fever is not as great, and unfortunately, its ability to overpick typhoid fever is also not very great. So you can have somebody who doesn't have typhoid fever but would have high titers in the Widal test. You can have somebody who has had a previous typhoid fever, and because antibodies have already been developed, this is picked in the bloodstream. And you can have a lot of other things that cross react. And generally, the World Health Organization has recommended that it is not a reliable way of making a diagnosis of typhoid fever. Okay, I would see people coming to the clinic and said, Doctor, I've just come back from the lab and this is my results. They said my Widal is high. I need antibiotics, and many times I sit down and try to take the patient's history, examine the patient all over again, and do counsel them, because part of the challenges we are going to face is antibiotic abuse, which would lead to antibiotic resistance. Okay, you would end up using antibiotics when you usually do not need to use the antibiotics. Okay, so so how does typhoid fever present? Now, again, at the end of the day, your doctor needs to be the one to help you to make a diagnosis. But yes, you can have those constitutional symptoms. But one other thing that typhoid is called is that it's called enteric fever, meaning that it is something that affects your gastrointestinal system, your in stomach and intestines. Okay, so people might usually have abdominal pain, what we call tenderness when the doctor touches, vomiting, diarrhea, and a number of other abdominal symptoms. Okay, so if we say the Widal test is not reliable, what is the best way of diagnosing typhoid fever? The recommendation is a blood culture, okay? But what we've also found out is that most of the times when people actually think they have typhoid fever, they actually do not, okay? Because many times the clinical signs do not add up. I mean, the person doesn't even have a fever, I mean, amongst other things, okay? So I want to encourage you to work with your healthcare provider to make up appropriate diagnosis and for you to be able to avoid antibiotic abuse. Um, is it possible for you to treat malaria and possibly still have symptoms? Absolutely, okay, because sometimes it might take a while for the parasites to clear from your system, okay? But then, even if we have what we call treatment failure of malaria, the recommendations are usually to use what we call a second line of the antimalarials, and your doctor can advise you on that. I want to keep it at that because this is just for health education purpose and not a consultation, because your doctor needs to be the one to guide you on that. It's also important to know that we can have some of these non-specific symptoms that may be viral illnesses, stress related, and all of that. And you want to look at all of that. Look at how much rest are you getting, how well are you feeding. But all in all, please work with your doctor in being able to make appropriate diagnosis. You do not want to create antibiotic resistance. We've seen people that when they are actually ill and we take samples from them and run it against different antibiotics, you found out that there is almost no antibiotic that the organism in them is going to respond to, because most likely one of the possible causes is having been exposed to lots of antibiotics. Okay, so save the antibiotics for the day that you truly need it. I hope this is helpful in helping you to take care of your health. If you have questions, I will be glad to answer. You can drop in the comment section, and if somebody you know needs to hear this, why not go ahead and share? Thank you and have a lovely day.